with our health and everything. So this is just a brief overview that I want to come to y'all about. First, we're going to talk about the causes of breast cancer. Getting old, that's all of us. So we all going to be closer to getting breast cancer. We hope not, though. But getting old, most breast cancers are diagnosed in women 50 and older. Also, it can be genetic. Mutation in genes like the BRCA1 and BRCA2 significantly increases the risk. And BRCA1 and BRCA2, that is a gene that you get one gene from your mother, one from your father. And it's actually a gene that's supposed to stop us from getting cancer. But for some reason, it mutates and acts up, and it gives us a higher chance of cancer. Also, if you have a family history of having a close relative with breast cancer, increases your risk. Having dense breast makes it harder for the mammogram to see the tumor. Personal history, having had history in one breast increases the risk to develop a new one. Radiation exposure. If you received radiation therapy in your chest in adolescence, it increases your risk. Hormonal factors, early menstruation, late menopause, never giving birth, or having your first child, or having your child after the age of 30 can increase your risk. Also, certain benign tumors, how women sometimes they have a lump, but it's benign. That means it's not cancerous. That also exposes you more to having breast cancer. Some warning signs, and we'll go over some of those after the presentation. Warning signs, unexplained weight loss, 10 pounds or more if you're not trying, a lump or error, a thickening of the skin, discharge, fatigue, or lumps under the arms. That the lumps under the arm is your lymph nodes. You have to, and I gave you a handout that show how to check your breasts and everything. Now we're going to talk about breast cancer in men. Okay, breast cancer can occur in men, but it is rare. About 1% of all breast cancer occurs in men. The average age is 69. Risk factor is a family history of breast cancer, gene mutation, hormonal factors, certain medical condition, and the Klinefelter syndrome. And I'll tell y'all what the Klinefelter syndrome before it's over with. Symptoms are lump or thickness in the breast tissue, nipple discharge, it can be bloody or clear, nipple inversions, skin changes, redness, dimpling, pain or discomfort in the breast. Male breast cancer is often diagnosed later than women's, and then when it happens, sometimes it's in a later stage because, first of all, men don't think they can get breast cancer, but they can, and they don't do self-checks like they should for their breast. Okay, test for breast cancer. The BRCA1 and 2, which this is normally a tumor suppression gene, but like I said, it'll mutate and sometimes it'll go wild. And this is the gene that you get from your mother and father. If BRCA does a mutation, it can allow you to get breast cancer, pancreatic cancer, and prostate cancer, and ovarian cancer. And this is another test for breast cancer, mammograms. Okay, you should have a mammograms every 2 years from the age of 50 to 74. And at 75, if they don't think you got 10 years to live, they don't want to waste the money on you. Sad to say, but that's it. And mammogram is a low-dose X-ray exam that creates image of breast tissue. It's recommended for women over 50 or younger if they have family history of breast cancer. Also, you can do the ultrasound, which is just where the waves are created to show the shapes, the images of the breast. Then you can do the MRI, which is a detailed imaging test that use magnets and radio waves to detect the lumps or whatever. Then you can also do a biopsy, which is just to obtain a tissue sample. But some of the signs, I think I gave out some handouts for some of the signs of breast cancer, and I'm gonna go over some of the signs and of what you need to look for, men and women. I know a lot of men, they don't think that it can happen to them, and it is rare, but it does happen. Okay, what the breast can look like, and I think Minister Valerie has the also on her side. Oh, she got the slide up, the slide. Okay, okay, the thick areas, dimples, nipple crust, red or hot, new fluid, skin soreness, bumps, a vein, a big enlarged vein in your breast, sunken nipples, and new shape of size. And then it looked like an orange peel. It looks rough like, and then the hard lump. Okay, now we're going to talk about prostate cancer. Prostate cancer is a growth of cells that starts in the prostate. Prostate cancer is one of the most common types of cancer. Prostate cancer is usually found early and is often grows slowly. Most people with prostate cancer are cured, except it's different in black men, and we'll talk about that in a minute. Symptoms, early stages, blood in the urine, blood in the semen, need to urinate more often, trouble getting started when trying to urinate, waking up a lot to urinate, and some don't get all excited if y'all do that because as you age, the prostate enlarges, and sometimes that causes men to have problems. Uh, Signs and symptoms of advanced prostate: accidental leaking of urine, back pain, bone pain, difficult getting an erection called erectile dysfunction, feeling very tired, losing weight without trying, and weakness in the arms or legs. Okay, and some of the tests for prostate cancer is a PSA, which is just it's a blood test that they measure the level of PSA, a protein produced by the prostate. And you should get this test from 55 to 69 every 1 to 2 years. 70 and older, they say discuss, like when you get old, they don't care. They say discuss the benefits with your doctor. Okay, then also you can have a digital exam, which you should get that, they say, from 40 to 45, 50 every 1 to 2 years. And it's a physical exam where a doctor inserts a gloved finger into the rectum to feel the prostate for any abnormalities. Then you can get a transrectal ultrasound. It's just an imaging test that uses ultrasounds to create the image of the prostate. You can also have an MRI, which the MRI is a more detailed image test that can provide detailed images of the prostate. You can have a biopsy, which is a small sample of prostate tissues, is removed and examined under a microscope. Also, they can also see some markers of prostate cancer in the urine. Now, the risk factors. One of the risk factors was drinking and smoking, and that's with any cancer. Drinking too much and smoking can increase your chances of getting cancer. Okay, the risk factors for prostate is older age. The risk of prostate cancer goes up with age. It's most common after 50. Race. In the U.S., black people have a greater risk of prostate cancer. Black people, prostate cancer also is more likely to grow quicker and be more advanced when detected. That's why it's so important that black men get their prostate checked and have the blood tested. Also, if a blood relative, such as a parent or sibling, has been diagnosed with prostate cancer, your risk may increase. Also, the family history of the BRCA1 and 2 that we talked about, if you got a family history of that, it's more than likely that you could have breast cancer. Okay, higher risk with obesity, prostate cancer is more likely to grow quicker and more likely to come back after treatment. And that's basically it. The main thing is that we need to make sure that we go and have all our tests done because, as I say, we suffer and because of lack of knowledge. And yes, ma'am. Question? I did look that up, and they said they think it has something to do with our genes. Then they think it's because they said that we are poorer and we seek health care later. And that's basically what they say. It could be a gene thing, it could be a hormonal thing, but they didn't actually pinpoint why. But like I said, it is more aggressive in black men than any other. Right. It's BRCA1 or 2, and you get BRCA, 1 or 2, and I may be pronouncing it wrong, but it's BRCA1 2. But it's a gene that's supposed to suppress, but instead, it mutates, and then it just get out of whack. And other